How safe is it for vaccinated people to return to in-person work? An expert weighs in. At the same time, Disney, Netflix, Google, Walmart, and the federal government announced plans to implement some type of vaccine requirement for employees returning to in-person work. Dr. Leana Wen, vaccine requirements will help make workplaces much safer for everyone. Here's why. There is a lot of misunderstanding about what the CDC's new data is showing. The agency found that vaccinated people infected with COVID-19 may carry just as much virus as those who are unvaccinated and have COVID-19. Put a different way, if I have to spend time in an enclosed, indoor space with someone, the chance of that person having coronavirus and potentially being able to infect me is an estimated 8 times less if they are vaccinated. That's why vaccine requirements at work make sense. It dramatically reduces the chance that your co-workers could be infected. And because you are vaccinated, too, your chance of getting COVID-19 from them is also reduced an estimated 8-fold from if you were not vaccinated. Could it be possible that someone has coronavirus, and you still contract it from them? Yes. The higher the coronavirus transmission rate in your community, the more likely someone has COVID-19, even if they are vaccinated. However, it is much safer to share space with people when everyone is fully vaccinated. When, it depends on how frequent the testing is. Testing is not a strategy that prevents someone from contracting COVID-19. However, if there is frequent testing, it could pick up on infections quickly and prevent that person from spreading it. I'd feel more comfortable with twice-weekly testing than weekly testing. Either the antigen test or PCR test should be fine, as long as it's authorized by the FDA. Test less frequently and I think you get into a situation of false reassurance. Just because someone tested negative a week ago doesn't mean that they couldn't have contracted coronavirus in the meantime. And if they are unvaccinated, they have a higher chance of getting COVID-19 and therefore of passing it on to you.
This is an interesting question, and one that the CDC has not really weighed in on. Right now, the CDC is saying that indoor masking should occur in areas of high or substantial COVID-19 transmission, and they are not saying that if everyone is vaccinated, masks are no longer needed. I think this is a mistake. The risk of vaccinated people transmitting to other vaccinated people is low. At some point, we have to accept that we are not going to get zero risk. Workplaces need to protect their employees, and a vaccine requirement is a very good level of protection. If a workplace truly has an enforced vaccine mandate with proof of vaccination, I think they could make masking optional instead of required. If the workplace doesn't require vaccines or masks, and you know that you are surrounded by maskless people who are probably unvaccinated, that's a much riskier situation for you. Know that you are still well protected from severe illness, but depending on the infection rate in the community around you, you could be at risk of a breakthrough infection. Try to take steps to protect yourself. Wear an N95 or KN95 mask when in close proximity indoors with these maskless people of unknown vaccination status. Try to stay distanced from them, and if possible, ask for accommodations to sit in a separate space. Open the window and door to increase airflow. Stay out of crowded gathering areas like break rooms and cafeterias. Know that risk is cumulative. The more people you are exposed to, the higher your risk. This is really tough. Many people are in this situation where we may not be so concerned about a breakthrough infection to us, because chances are it will be mild, but we are very concerned about potentially being a carrier who could infect those we live with. Taking precautions at work is important. Vaccine requirements would make me feel much safer. I'd be comfortable going to work and not wearing a mask if everyone around me is guaranteed to be fully vaccinated. I'd probably still try to stay out of the highest risk settings, like cramped, poorly ventilated conference rooms where dozens are sitting shoulder to shoulder for hours at a time.
If I'm not certain that the others around me are vaccinated, I would make sure to wear a high-quality mask when around them indoors. Other people will be even more cautious. Someone who lives at home with an elderly parent on immunosuppressant medications may want to follow the CDC guidelines to the letter and wear a mask even if everyone around them is known to be vaccinated. Still others may choose to work at home if that's an option available to them. We all have different tolerance of risk, and I hope companies will try to make reasonable accommodations for people's living situations. This is a very confusing time for everyone. It feels like the US has taken a step backward in our fight against the pandemic, and we have. The Delta variant has changed things again. We need to keep being vigilant, reassess our own risk in our families, and keep in mind that vaccination remains key to protecting ourselves and our loved ones.
Thank you for watching. Please subscribe